Let's talk about medically assisted treatment, or MAT, just a little bit. There's a lot of preconceived notions about using medication to help people recover from drugs or alcohol. One of the most common medications used is Suboxone for the treatment of opiate addiction. People think that they're just transitioning from one addiction to another addiction, and that's really not the case. Behavior around these two drugs is the difference. Behavior around heroin or opiate medications often becomes very addictive type behavior. People need to score heroin or opiates several times a day, maybe 5, 6, 7 times a day. They're going into withdrawal every few hours. They wake up in the morning craving the medication or the drug. They're going to bed at night thinking about the drug. During the day, a lot of the thoughts are around, how do I get it? When you're buying it on the street, you might be spending a lot of money. You might be spending $20, $30 per pill. That becomes very expensive. So the behaviors around that, people might be stealing from their parents. People that have a lot of money are just spending a lot of money on this. You see people spending $200, $300 a day on their addiction. The second that you transition over to Suboxone, you're now on a medication that's prescribed by a doctor. All the behavior immediately goes away. Suboxone, you take it once in the morning. You're on a medication that's prescribed by a doctor. All the tenets of recovery programs say if a medication is prescribed by a doctor, it's safe for your recovery. So the behavior around medically assisted treatment is completely different. You take a pill in the morning, you're good all day long. You're no longer involved in the drug addict behavior, scoring drugs, finding a drug dealer, going to the street corner, stealing money. All that behavior changes immediately when you go over to a medically assisted treatment. Now, Suboxone is just the beginning of recovery. Suboxone alone is not true recovery. It's a great start. It's better than taking heroin off the street. It's better than buying pills on the street, but it's just the start of recovery. A real recovery program includes medication and therapy. The more you throw at your recovery, the stronger it'll be. That involves seeing a therapist pretty frequently. It might involve AA meetings, NA meetings. The more you put into a program, the stronger your recovery will be, the more long-lasting that it'll be. So Suboxone is just the start. Medically assisted treatment is just the start. You really need to throw lots at it, and that's going to create really the foundation for lasting recovery, and that'll be the start of your program, and that'll be the start of lasting recovery.